Affordable healthcare remains crucial for countries in Africa. Getting top-notch delivery at no cost is at the heart of what the Sir Emeka Okwuosa Foundation is offering in Nigeria. Watch this special on how the foundation is giving people another chance to life through open-heart surgeries in Nigeria. Healthcare delivery in Nigeria is set to be far from where it should be. From infrastructure, skills, manpower and facilities, the sector currently isn't meeting the demand of the country's population. With the participation of the private sector, health-inclined foundations and philanthropists, the narration is gradually changing. Hello and welcome to this special episode of Focus On, where we'll spotlight the activities of the Sir Emeka Okwuosa Foundation and the significant impact it is having in Nigeria's healthcare sector by embarking on biannual medical missions in southeast Nigeria. I'm Akin Obakeye. The Sir Emeka Okwuosa Foundation, championed by philanthropist and businessman Emeka Okwuosa, is towing the path to make significant impact in healthcare delivery by specifically carrying out open-heart surgeries in partnership with VOOM Foundation. The idea is to provide high-quality healthcare services to people in dire need and at no cost. In 2022, over 32 open-heart surgeries were performed in the state-of-the-art Dame Irene Okwuosa Memorial Hospital. This year, the first of such outreach is already making an impact, attracting people from across the country. With a few numbers of open-heart surgeries performed annually, the turnout shows more needs to be done. But how can this be achieved?
Over 200 million people live in this country, and yet open heart surgery is only made available to a very select few. I would say that I think by last year's account, maybe about 200 open heart surgeries were performed in a country where, if you contrast that to what happens in the United States, where an average hospital does far more than 200 cases a year. So you can see whereas we are celebrating the fact that we have accomplished quite a bit in Nigeria, we haven't scratched the surface. And this is definitely something that we can identify with in our organization and VOOM Foundation. And we have access that is made available to even indigent patients who otherwise would not be able to afford having this sort of quality care. So Emeka Okwuosa has literally created an environment where VOOM Foundation can come in and provide high quality care, especially in cardiac surgery, without any sort of intrusions on his part on how we select patients that are taken care of in this environment.
We start reviewing patients months before we arrive. When we arrive with an entire team of people. We arrive with physicians, nurses, respiratory therapists, anesthesiologists, perfusionists, or people who run the machines that we operate on. And those people, when they come here, those team members team up with people here in the country to train them to do what they do. So our goal is not just to train a surgeon to operate, because that surgeon cannot operate independently. He can't. He needs a nurse, he needs an anesthesiologist, he needs a perfusionist, and he will not be successful if he doesn't have the right team. So it's to train teams of people. While we're here, we round every day. Our staff members, or our volunteers, I should say, partner with the staff members here. And we round every day on every patient. We have teams of people that take care of people. After we leave the country, if any patients are left behind, The physicians and I, the team, round every day on the patients and discuss them till they leave.
The man at the heart of this is Emeka Okwuosa, and he shares some perspective on why he wants to make a difference.
I could see the massive gap in healthcare delivery in Nigeria. It's a big challenge, just like you have in developing countries, but ours, the gap is massive, massive, so to say. I started by just trying to build a hospital that would provide primary health care and general medical treatment. But as we commenced that process, Providence put us together with VOOM Foundation. I got to know Dr. Vincent Ohaju, who is the proprietor of VOOM Foundation. The cooperation we have between, Emeka Okwuosa Foundation and VOOM Foundation is quite unique. Unique in the sense that each entity has been striving to do the best in what we set out to do. So it's actually a meeting of common minds. VOOM Foundation, as I've stated earlier, they have been on this within Nigeria. And when I got to see what they've done so far, and I also have seen the flip side of it, and what do I mean by the flip side? The fact that some of the activities they've been involved in, they had not gotten the right response by the cooperation of the entities involved and by the sustenance of that process over time, because it requires commitment and investment continuously to keep it going. When we teamed up with them, I made up my mind that those gaps must be bridged. They have brought in here human capacity. They brought in here materials to support us. They brought in here equipment to support us. We have invested a lot in equipment, a lot in materials. So we are working very closely together. Some experience we've had here based on past activities, based on past surgeries that have been done here, it's good to see even young kids who prior to that could not live a normal life. You see them smiling, jumping, and being able to actually be human beings again. There's nothing more joyful than that.
Ensuring a seamless process remains crucial to the success of the mission. The Chief Medical Director of the hospital gives us some insights into the processes and assessments of patients before and after the surgical procedure.
The selection of patients is based primarily on medical grounds. Okay. Then patients who come in from both the VOOM Foundation, Emeka Okwuosa Foundation, are assessed in this facility by specialists, cardiovascular specialists, and difficult cases are then selected, right? So criteria based on not just what the patient has, that is the diagnosis of the patient. Which is like, would this patient do well if operated upon? After surgery, what is the health-related quality of life post-care? What is the patient's prospects after surgery to the family, to the community? What are the chances of the patient surviving the surgery? Then beyond that, also other social aspects come in, which is also part of the clinical assessment. How do we define the underserved communities who, if this mission, irrespective of this mission, can get access someplace else in the country or somewhere else in the world? Who needs it the most? So those are all parts of what goes through our process of patient selection. Then we also factor in, even when we have cases that are quite bad, that not necessarily we might not be eager to operate on, we factor in how long would these patients live if we don't intervene.
Some patients also share their thoughts on how much being a beneficiary means to them.
Before this time around, the thing was too bad for me. In fact, I don't know that this kind of a thing can be changed. And somebody will remain the way I am now. Because then I can move 1 kilometer move from here to the other step. I will be feeling too much pain in my heart. I don't know that I can return to the normal life again. I was thinking that I would just from here and pass away. Then this thing, the way the doctor told me is going to be working on me, shows that it's like a new heart was put on me, meaning a new life.
Sometime last week, it's like I'm a dead person, but God made it possible for me today to be alive. I've been praying for him. God, the man wants to save life, and he's saving life already. For the fact I'm among people that he saved life, God will always bless the foundation.
The success of the mission hinges on some key elements, including funding. What are the mid to long-term goals of the foundation in sustaining the mission?
Currently, this is funded by Emeka Okwuosa Foundation with a very strong support of the OISAF group of companies. So on the net, we are still putting in, we are still developing. But when we started, we knew it was going to be this way. Even if it's just ordinary business, you hardly start it and start making profit the first day. So what is important is to remain focused. And we are focused. Now, to be sustainable, we have to be cash positive, we have to be profitable, and we are taking it step by step. Things we have to do to get to that is already we built up the place. We will still have a chance, and we are working on the next stage of development of the hospital. But irrespective of that, of course, when you go for that level of development, you're looking at capital costs.
The foundation, the pillars that going forward, we're really looking to continue to consolidate on and grow our health, education, and socioeconomic empowerment programs. So I'll take, for example, in response to your question, the socioeconomic empowerment programs. So as part of that, we have a few projects in mind. A lot of them require partnerships, like you discussed, so be it with private sector companies or be it with the public sector. So one of the things we're looking to do is the Emeka Okwuosa Women Enterprise Program. So that in itself will involve a range of different partners. So anything from banks to small and medium enterprise. That we recognize that we absolutely can't run these programs by ourselves. And if we try to, our beneficiaries who are supposed to be getting the maximum value out of them are not going to be able to get what it is that they need. So going forward as a foundation, we're really looking to collaborate with people across Nigeria and internationally in terms of being able to provide the best possible when it comes to our programs. And like you said, other things like funding, of course, ensuring that that's sustainable.
We don't want to leave any of the pillars behind. So in as much as we're designing health-related programs for and the hospital is a channel where we implement it, we are also very conscious, in designing programs around education and socioeconomic empowerment. But on a personal ground, I'm also a very good advocate for inclusion.
Now, in just 1 year, the Dame Irene Okwuosa Memorial Hospital has been instrumental to the health-related successes of the foundation. We can only anticipate more achievements and impacts the mission will have on beneficiaries in Nigeria and Africa. Thanks for staying tuned to this special episode of Focus On. I'm Akiyobakeye. Until next time, it's bye for now.